Thank you very much for the invitation to talk today, and thank you for the introduction. I am Liz Herrieven. I work in a children's emergency department in Hull in the north of England. And so my day job is seeing children with injuries and illnesses that are brought to the emergency department. I also work with the Down Syndrome Medical Interest Group in the UK and Ireland. And I have a special interest, as was mentioned earlier on, in the health of people with Down syndrome and how they access healthcare and stay healthy. Hopefully the slide will change. I am not great at technology. Okay, so this young lady is the reason for my special interest. This is Amy. She is 15 years old now, and this photo was a couple of years ago, but it's one of my favorites. She has Down syndrome and she is autistic. And she's had a really tough time, particularly in the early years, because of health problems. She was born 10 weeks early, and she spent 8 weeks in the neonatal intensive care unit. And over the next few years, she had many admissions to hospital with bronchiolitis, with pneumonia, with sepsis, with various other infections. She caught all the usual childhood illnesses, but she seemed to get them worse than her friends who didn't have Down syndrome. And for example, when she had chickenpox, she ended up in intensive care. She's had operations on her heart and on her hips, and she's been followed up in all sorts of different clinics. So she's a professional when it comes to going to hospital. And I know that for many of you listening, that story will probably be quite familiar. Some of you may have been quite lucky and will have had children that have been relatively healthy in the early years, but it's not uncommon for children with Down syndrome to spend a lot of time being unwell and to go from one infection to the next to the next. And there are lots of reasons behind this. So one of the issues is that people with Down syndrome have a weaker immune system compared to other people. There's not a huge amount that's known or understood around this, but we know that it's to do with the way that the immune system functions and the cells interact with each other. It's just not as strong in people with Down syndrome as it is in others. So people with Down syndrome, and in particular children, are more likely to catch infections. They're more likely to become more seriously ill with infections, and they're more likely to get sick very quickly with infections. Another issue is something that we talk about as being comorbidities, and that means other illnesses and other health problems. And we know that our children are far more likely to have things like a heart problem or a bowel problem, for example. And these things, although they might not mean that the child catches more illnesses, it means that the body might not be able to deal with that illness in the same way as somebody without those extra health problems. Another issue is to do with the anatomy that our children have. And all of those little airways and tubes in the head and the neck and in the chest, the things that connect the ears to the airway, the little airways within the lungs, are all shorter, narrower, and they're not angled quite so well as they are in other people. So they tend to accumulate fluid, and fluid becomes backed up in those canals and in those tubes and can become infected. Now that fluid is mucus and snot, and in our children, snot tends to be thicker anyway, and they tend to produce an awful lot of it. I'm sure you're used to constantly wiping small children's noses, as I was for many years. And that makes them more likely to get ear infections, coughs, colds, chest infections, pneumonia. So those things are all things internal to our children, within our children, due to Down syndrome, that makes them more likely to become seriously unwell. But there's lots of other things as well that we need to consider that put them at a big disadvantage when they're unwell. And those are more to do with how medical staff, doctors, nurses, assess our children. And I can say as a doctor that the medical profession has a lot to learn quite often about our children and how best to assess them. For example, sometimes our children will not have the typical symptoms and signs of illness that other children will. Their illnesses might be disguised. It's not uncommon for children with Down syndrome to have sickness and diarrhea as their main symptoms, when actually the cause is a pneumonia, a very nasty chest infection. Other children might present with a cough or shortness of breath, for example. And so it's important that health professionals understand that our children can present differently and that they do a thorough job of assessing them. These are some of the other things that make assessing our children more challenging. Not impossible, and I'll come back to that in a moment, but certainly more challenging. Many of our children have sensory processing problems. So that means that the body misinterprets or misunderstands signals that it receives. So a bright light or a loud noise might be perceived as being quite painful or upsetting. A light touch might be very distressing, and a firm, deep hold might be more comforting. So examinations in hospital that might include things like checking oxygen levels, checking temperatures, doing blood pressures, feeling a tummy, listening to the chest, will all be more upsetting for the child and more challenging for the doctor or nurse. Communication can be an issue as well. So our children might find understanding the medical staff more difficult, particularly if the medical staff are talking very quickly or mumbling, or if the child is used to using signs or symbols in communication. Similarly, it might be that the medical staff find it very difficult to understand our children. And so that's another element that makes things more challenging for the medical team. Another issue is that our children have often been in and out of hospital lots and lots of times, and they've had all sorts of horrible things done to them. They've been poked and prodded and had needles and tubes and all sorts of things. So they may well be very scared and very wary when they're being assessed. Usually with any other child, we can do quite a bit in the way of distraction. So we can use bubbles, we can use pictures or videos to distract a child when we need to do a procedure. But if a child, whether they have Down syndrome or not, has been in and out of hospital lots of times, that distraction becomes very difficult. And the child is not daft. They know that if the bubbles come out, something horrible might happen. So it's far more difficult to distract our children. So this all makes things more difficult when they're being assessed in hospital. But there's lots that we can do as parents to try and support that process. So, for example, making sure that the health professionals speak slowly and clearly, perhaps using symbols if needs be, or pointing to things to give a visual support to that verbal information. We can explain if our child has a sensory processing problem, or perhaps ask them to do some of the nastier, more uncomfortable things towards the end of the process. And we can help with distraction. We can suggest things that might work, or alternatively, we can say, do you know what, for Amy, when you take her blood tests, she's not going to be distracted. She knows exactly what you're going to do. So it's better off if I just give her a big cuddle and we get it over and done with. Pain is a really big area that can cause challenges. And this might be because the child has a sensory processing problem and finds it difficult to understand and interpret the signals of pain that the body is receiving. Or it might be that there are communication issues and the child finds it difficult to express that they're feeling pain. Amy certainly can be quite confusing where pain is concerned. She will constantly talk about being in pain and things hurting, but actually I know that they don't. And that's her way of trying to get out of doing something she doesn't want to do. So she will say, for example, that her leg hurts when she doesn't want to do PE. However, when she is really in pain, she goes very quiet. She gets withdrawn, she gets upset, and she doesn't speak. And that makes me as a parent know that she's in a lot of discomfort. So that can make, again, assessment for healthcare professionals very difficult. So we may need to do some interpretation to help them to understand what's going on with our child. A really massive area is something called diagnostic overshadowing. And this happens when somebody has a pre-existing diagnosis and healthcare professionals decide that any symptoms they have are down to that diagnosis, and they don't look for other things beyond that. So, for example, a child may have Down syndrome and they may be in hospital and be very quiet, not communicating, and they might seem to be quite floppy. And the doctor might decide, well, that's just Down syndrome, without looking further and without assessing for things like infection or sepsis or a serious injury that might be causing that presentation. So it's important, again, that we are very clear as parents that we know what our child is like when they're well, and that at the moment something is wrong with our child, even if we can't put our finger on it. So what can we do about trying to keep our children healthy? I've mentioned a lot of advocacy, which can be exhausting for us as parents, but there are other things that we can do as well. And one of those is really just good hygiene. That might sound really simplistic, but actually during the pandemic and with the lockdowns, we've seen that by washing hands, by wearing masks, by staying away from people that are unwell, not only have we managed to reduce a huge number of the COVID infections that may have happened, but we've also managed to massively reduce sickness and diarrhea, coughs, colds, influenza. Those infections have been almost non-existent during the pandemic, all because of good hygiene measures. So by continuing with some of those measures in the longer term, we can continue to prevent serious illnesses for our children. Another area that might also sound very simple is good nutrition, but in our children, it often isn't that simple, is it? Our children might have difficulties with certain tastes or textures. They might have quite a restricted diet. They might have difficulties in knowing when they are hungry or when they're full, and so they may overeat. But concentrating on a healthy, balanced diet is one way that we can keep the body strong and functioning and help to be able to fight those infections and illnesses when they come along. Often we think about supplements and things that we can give to our child over and above that balanced diet to try to keep them healthy. And the two that are probably worth considering are vitamin D and iron, because those are the two that are most commonly low in our children. I certainly would suggest getting those tested if you get opportunity, and if they are low, then giving supplements. There's been a lot of discussion in recent years about whether giving cocktails of high doses of vitamins might be beneficial, not just for the health of our children, but for the development of our children. But unfortunately, there's no real scientific evidence to back that up. For some vitamins, giving too much is dangerous. And for the rest, it's pointless because the body will just get rid of the vitamins it doesn't need. So we put high doses in and it will pee them straight back out again. But certainly vitamin D and iron are something to consider. Vaccination is another way that we can ensure that we're doing our best to keep our children healthy as well. And not just the routine childhood vaccinations, but also considering things like the flu vaccine, which should be given annually. Giving that not only prevents the flu, but it can prevent the complications of the flu, which include pneumonia. The pneumococcal vaccine is also a really good one for our children to have. And in the UK, certainly it's recommended that they have a dose before the age of 2 and another after the age of 2. And that can prevent meningitis and pneumonia caused by the pneumococcal bacteria. There's a lot of discussion about the chickenpox vaccine, and some countries will offer this routinely and others won't. Unfortunately, in the UK, we don't. But our children are more prone to severe episodes of chickenpox. And chickenpox can cause things like brain inflammation and failure of the lungs. And so that's something else to consider. Another good way to make sure that we're staying healthy is regular health checks. So in the UK, again, these are recommended annually. And it's a good opportunity to make sure that somebody is keeping an eye on height and weight and growth, and checking for anemia and thyroid problems and celiac disease, and watching out for all of those things that might make it more difficult for our child to manage if they encounter a serious illness. So I've mentioned sepsis, and it's certainly true that children with Down syndrome are more prone to sepsis. But what is sepsis? So thankfully, it's fairly rare, but it can be fatal. It can be disastrous. Sepsis happens when an infection comes along and attacks the body, and the body's immune system fights back at the infection, but goes completely over the top. And instead of just fighting the infection, it also starts to attack the body's own organs. So somebody with sepsis might have heart failure, they might have breathing failure, they might have kidney failure. One of the big problems with sepsis is that although it's fairly rare, it's very difficult to diagnose. Everybody that has sepsis, by definition, also has an infection. So it's difficult to know sometimes which symptoms and signs are due to the infection and which are due to possible sepsis. And sepsis develops with time. So a child might see a doctor on a Monday and be diagnosed with a virus, but on Wednesday, they may have sepsis. And it doesn't mean that necessarily the doctor has missed anything on the Monday. It means that that sepsis has probably developed in that time. There's no test that we can do to tell whether or not somebody has sepsis. But there are good treatments once it is identified. So it's important to look for things that we call red flags that can show us that somebody may have sepsis. I also want to mention temperature. Now, our children find it difficult sometimes to maintain their temperature and to control their temperature. So they may be sweaty when the rest of us are cold. They may be cold when the rest of us are warm. And when they're unwell, they might not always get a high temperature. Having a temperature actually isn't a bad thing, and it does have its role in fighting infection. Under the ages of about 3 months, a high temperature with a baby is always a red flag and a sign that the child might have sepsis. But after that age, it's less reliable. And actually, you can have a very high temperature, but not be too unwell, or a normal temperature and be very, very poorly. So it's important not to focus too much on temperature when somebody's unwell. Soft signs are something that I'd also like to introduce. Now, these are the things that we as parents notice about our children and give us a clue that something's not right. And they may be very vague, and it might be that we don't know what's right, what's gone wrong with our child, but we know that something's not right. There's been studies that show that parents and family members of loved ones with a learning disability are often better at picking up serious illness in their loved one than doctors and nurses are. And that is often because of these things, soft signs. And in an attempt to try and make these more well known to the medical teams, lots of work has gone into trying to put them into different classifications. This is one of my favorite posters about soft signs. So for Amy, for example, soft signs for her might be that she doesn't want to watch her normal TV program, that she doesn't want to eat her favorite food, that she's perhaps a bit quieter than usual, perhaps a bit paler than usual, maybe doesn't go to the toilet as often. And those are all things that, for me as her mum, give me a good clue that something is wrong, even if I don't know what that thing is. And so the big important thing about soft signs is to trust yourself. If you as a parent feel that your child is not right, believe yourself and trust yourself, and make sure that you get them seen. Hospital passports can be really helpful when it comes to assessing our children. These are a document that you fill in advance and store at home, but then take to hospital and appointments with you. And it will list things like illnesses that your child has had or medications that they might be taking. But also it has some really good information inside about what might comfort your child, what might scare your child, what your child might do when they're in pain, or how best to communicate with your child. And this is the really vital information that I believe that all healthcare professionals need to know when they're assessing our children, so that they can do a much better job of assessing them. There are lots of different forms of hospital passport on the internet, but if you get the opportunity to use one, please do. The reason that I do lots of education for doctors around this area is because we hear very little in medical school about Down syndrome. I had one lecture and I was told that Down syndrome was a chromosomal condition, and I had to learn a list of things that the child might have when they're born. So Palmer crease and almond-shaped eyes and things like this, which is no use at all when it comes to being a doctor and looking after children or adults with Down syndrome. The things that are far more important, I've had to learn for myself. But luckily, there's a lot of work now going on trying to educate healthcare professionals. This is a poster that I put together with a colleague a few years ago now, and it summarizes some of the things that we've been talking about just now. So knowing that communication is important, knowing that our child might not get a temperature when they're unwell, the fact that our children have weaker immune systems or are more likely to have comorbidities, other health problems. This poster is available on the UK Down Syndrome Association website. So I want to talk about some of the things beyond the soft signs that we need to look out for, those red flags that suggest that our child might have sepsis or another serious illness. First off, your child not responding as usual. And this might be verbally, or it might be in other ways. You know your child best. And if they're not responding to something as you'd expect them to, then that needs to be flagged up. A child not waking up properly or having difficulty staying awake is another one. That's another red flag. And that should be something that should prompt a healthcare professional to need to assess them properly. For babies, a weak, high-pitched or continuous cry. Now, babies cry all the time anyway, but if that cry has changed and parents know when a cry sounds different, then that's another red flag and another cause to get your child assessed. Grunting, bleating or moaning with every breath can be a sign that a child is really struggling to get enough oxygen on board. And they're trying at the end of each breath to trap some air inside their lungs to stop those small airways from collapsing. Now, a grunting noise that comes at the end of each breath sounds a little bit like this. And you might hear that in an older child or even in an adult. For babies, it tends to sound more of a cry. So it's more of a That sound, whatever it sounds like, that comes at the end of each breath and continues, is a red flag, and it means that that child needs to be seen urgently by a medical professional. Still on breathing, very fast breathing can be a red flag. Also, you can get very fast breathing with a high temperature. So that's something else to bear in mind. Pauses in breathing are also concerning. Difficulty breathing. Things that you can look out for include, in babies, head bobbing. So the baby's head will be bobbing up and down, and this is because they're using the muscles in their neck and in their shoulders to try to expand the upper part of their lungs, to try to suck more air in. Those muscles are really weak, really inefficient, and so instead of opening up the lungs and opening up the chest, it's just pulling the head up and down instead. So head bobbing in a baby is a red flag. In other children, including babies, you might see something that we call recessions. So that's where the muscles in between the ribs or at the front of the neck or near the collarbone or underneath the ribs are sucked in with every breath, oxygen as it can. But actually, those muscles are really inefficient and the muscles are being sucked in instead of the oxygen. You might hear noises with breathing. I mentioned the grunting, but also you might hear a noise when the child breathes in. It sounds a bit like this. That noise is a sign that there's something going on in the upper part of the airway, which might be croup or it might be a different type of airway infection. You might hear a rasping or wheezing sound when they breathe out. And that tends to show that there's something going on deeper in the lungs. So either asthma or a chest infection. The child may look very pale. They might look ashen, grey, or they might have blue skin. And that discoloration might be the whole of the body, or it might just be the fingertips and around the mouth. Again, that's a red flag. There might be a rash that doesn't go when you press on it. The vast majority of safe rashes that we don't worry about, if you press on them with your finger or with a glass tumbler and move your finger out the way, it will go pale and then back to pink again. But a rash that doesn't fade is more worrying. Now, one of the problems with our children, when we think about back to them disguising their illnesses, is that children with Down syndrome are more likely to get those scary types of rashes that don't fade when you press them, with all sorts of different infections and illnesses. And it doesn't mean that they're seriously ill each time, but for some reason, our children just make that rash more often. But if that rash has appeared in your child and it's new or it's unusual, or if there are any other signs that they're unwell, then they need an urgent medical assessment. And another one on here is not passing urine or making less wet nappies than usual. And that's a sign that the child might be dehydrated or their kidneys might be struggling. And again, that's something that needs a medical assessment. So I don't know how well you can see this picture, but there's some bluish discoloration to the fingers here. It is an adult's. Mom, just talking, Amy. Sorry, everybody, my daughter's just walked in. Mom, I'm just talking to lots of people about you. No. Paul. Excuse me, everyone. Do you want to say hello?
Yes, please.
Do excuse me, everybody. Very quick, because I'm talking to lots of people.
Oh, hi. Hi, how are you?
You okay?
Can you do a mute, please?
We're not on mute, they can hear you.
Hi. It's nice to see you.
Oh, you listen to that. That's my fault. I just had my headphones in.
It's nice to see you and hear. Hi. It's great that you are with us.
Do you want to sit quietly next to me and listen?
Yeah.
Okay. Yes. You sit quietly and listen and I will talk, okay?
Okay.
Excuse me, everybody. So the bluish discoloration that you can hopefully see on this picture, sit down, might just be those fingertips or it might be the whole body. This picture is of mottling, and mottling is a sign often of a child that's struggling with their circulation. Now, one of the problems is that children with Down syndrome tend to get mottled a lot quicker and a lot easier than other children.
Hello.
Shh, you have to be quiet. And that can mean that actually, as parents, we can get quite complacent because we see this mottling all the time and we know that our child is okay. However, if this is the first time your child has become mottled, or if they're unwell, or if it's unusual for them, then you need to seek urgent medical help. This is an example of the rash that I mentioned. So this is a very tiny red spot. And luckily, the tiny red spots that don't go when you press on them.
I'm going to see Dad.
Okay, go see Daddy. Shut the door behind you.
No.
The tiny red spots are the least scary of the rashes that don't go when you press them. But if this is unusual for your child, if it's not something they usually have, and if they're at all unwell, then they need to be seen urgently. This rash is more upsetting. This is bigger. It's more kind of reddish and purplish in color. And this rash is almost always associated with a very serious infection or sepsis. So this rash, if you do see it, needs to be seen urgently. I'm afraid I need to mention COVID, and we're still gathering lots of information about COVID and Down syndrome, and we're learning more and more all the time. But it seems to be clear that adults in particular, but also adolescents with Down syndrome, are at higher risk from COVID than other people. They're more likely to get a severe form of the infection, and they're more likely to end up in hospital. They're more likely to get complications, and unfortunately, they're more likely to die. The signs and symptoms that we'd be looking for are the same ones that I've already mentioned. So we'd be looking for signs of difficulty breathing, of fast breathing, of discoloration, and of not passing as much urine as usual. On top of the actual illness, COVID has had a massive impact on all of our children with regards to education and to social development. As well as them being more at risk because of the issues that we've already mentioned, they're also more at risk around issues to do with mask wearing, with social distancing, with hygiene. And it took me months to get Amy to wear a mask, and I'm very proud that she does. But those things have all put our community at increased risk. Luckily, we have some good vaccines, and I was very proud and very relieved when Amy got the first dose of her vaccination. There are lots of concerns about the vaccine, which I can completely understand, but the side effects and the complications from them are minimal. Allergic reactions are very, very rare. The usual side effects are things like headache, perhaps a temperature, or an achy arm. There's been a lot of discussion in the press and on social media about something called myocarditis, which is where the muscles of the heart become inflamed. Now, there have been some cases of myocarditis, and the numbers of those are different depending on which paper or which study you look at, but they're still very, very rare compared to the cases of myocarditis caused by the infection itself. So depending on which papers you read, there has been somewhere between about 12 and about 300 per million cases of myocarditis caused by the vaccine. So at most about 300 per million. Whereas with COVID infection, that number is at least 20 times bigger, possibly up to 150 times bigger. So an awful lot more chance of having myocarditis because of the infection. The type of myocarditis as well with the vaccination seems to be mild with no long-term effects, whereas that is not the case with COVID. It's a more serious form that we're seeing. So balancing things out, the risk of the infection for our teenagers, our children, is far bigger than is the risk of the vaccination. So I've talked through quite a bit of stuff there. I'm very happy to answer any questions, but I also want to say thank you for giving me the opportunity to speak to you. This is Amy and one of her friends, Shelby. And you've already met Amy. she gate crashed, but thank you very much for listening.
Thank you. Yeah, we have some questions, mostly in German, as I see. But I have a question. Does the vaccine protect people with Down syndrome as much as other people? Do we have any statistic about it?
We're still gathering information. It's still early days, but it seems to work just as well in people with Down syndrome as it does in others. It won't completely stop you catching it, but the idea is that if you do catch it, it's a milder form and you're less likely to pass it on to others. So there was one study that showed that in people with Down syndrome, you are more likely to be hospitalized if you didn't have vaccinations tenfold compared to those that had the vaccine.
Maybe we will continue with this question about vaccine and then later on go to other questions what we have. It's a question from our Jacqueline, our scientist friend, the mother from France. She asked, did in UK person with Down syndrome all received AstraZeneca vaccine with no side effects? Do you know maybe?
So certainly older people with Down syndrome will have received AstraZeneca. There was a decision made a few months ago to give anybody, whether they have Down syndrome or not in the UK, either the Pfizer or Moderna vaccine, the mRNA vaccines, because of the increased risk of abnormal clotting problems in young people with the AstraZeneca vaccine. So anybody now, I think under the age of 30, if they have a vaccination, is having the Pfizer vaccine instead.
Okay, thanks a lot, Liz. Who could help us with the German? Monica or Cora, maybe just that you translate for us these questions.
Yeah, I can do it.
Okay, thanks.
That's a question from Switzerland. The question is about the vitamin D and iron. And this mother asked if the amount of vitamin D and iron is the same as other children, or is there a different, are there different, is it a different mirror, it's called?
Okay. So the dose that you would take is the same that any other child would take. It's just that our children are more likely to be deficient in vitamin D and in iron. To be fair, many of us in this part of the world are deficient in vitamin D because of the lack of sunshine that we get. But the doses would be the same as for any child.
Okay, then she has another question about sepsis.
Cora, may I ask something about that question? It's related to that question. Do we need to have a pre-test before begin to use any vitamin?
Not for all of them. I think giving standard doses of multivitamin supplements is fine. Giving standard doses of vitamin D without testing before is fine. The ones where I'd get more worried is if you're giving high doses of things. Iron, for example, if you take the normal doses that you can buy over the counter, that dose is okay. But if you're taking bigger doses, that can be toxic unless you have low levels. So if you're just intending to go to the chemist or the pharmacy and buy normal doses, that's perfect, that's fine. If you're going to take bigger doses, I would not do that unless you've had levels checked.
Okay. Thank you. Then there is another question about nutritional supplements. What do you think about things like Nutrivein or something called Burgerstein? It's also something which is used in Switzerland.
I think there's no real scientific evidence to back up the use of high dose supplements. Unfortunately, there's been lots of studies to try and show the promise of these things, and it's always good to have hope around these things, but there's no evidence to suggest that they do any good. And unfortunately, a lot of the time they're also very expensive, and you are literally peeing it out. So your body's not absorbing things that it doesn't need. So we don't tend to advocate for the use of those.
Thank you. I think this is all in German, so somebody else can take over for the English questions.
Yes, I will do. Thanks, Cora. We have comments from Mirjana Wall. It looks like from the maybe UK, I don't know, but said our experience is that doctors and the nurses don't have a time to read the hospital passport, although we thought it would be very useful. is that your feelings as well?
I think one of the big problems is they don't realize how much it can help them. As a doctor, going to see a child, any child with a learning disability or autism, who might find my assessment very challenging, and in whom I might find the assessment challenging, to can make a huge difference. If I know that certain things that I do might upset the child, but other things might be more comforting, then I'm going to get the right answers when I assess that child. So I think that is to do less with the amount of time that the staff have. It might be a perception around time, but more to do with the fact they don't understand how important they are. We are trying to do lots of work to promote these, and I'm going to keep banging the same drum. But I think understanding our children and understanding what they need can do wonders for the amount that the doctors can learn from that assessment.
Yeah. Do you have maybe, Liz, experience that, like example, okay, if somebody's order or some test, are there any possibility to send in advance information of the person with disability, like example in your system in UK, in your hospital? That will be also one of the way of the preparation of people who are working in the hospital. I understand that the first day is not so easy because there is no ordering, but in the hospital, if you order, how you deal that in UK?
There's lots of bad examples too, unfortunately, but lots of really good examples. So for in our hospital, in the MRI unit where they do the MRI scans, a child was due to have an MRI and was really worried. And so the mum got in touch with the hospital and they arranged to send pictures. They couldn't visit because of COVID, but they sent pictures of what the room looked like, of what the scanner looked like, so that mum could talk through that with the child. If you're lucky enough to have contact with a learning disability nurse, they are amazing and can really help with this kind of thing, preparing in advance, putting together social stories or pictures or symbols to help. So on our hospital website, we've put together a social story for the emergency department. And you're completely right, in an emergency, you don't have time to sit and read through a social story. But if the children can read that in advance, they can get to know when they come to the hospital, which door they'll be going through, what the room looks like, what things might happen to them, and get used to things in advance. And I think there's also, I mean, another good example is down in Cornwall. The team there, including Angie, have put together a really fabulous book called Going to Hospital, which is on the Makaton website. And that shows a whole trip through the hospital that somebody can sit and go through with their child or their loved one before to show what might happen. Those things are absolutely ideal, but it takes work and it takes some planning.
Yeah, thanks, Liz. We have some question like, about statistics about cognitive degeneration. Do you have something about this?
I might not be the best person to ask that if we're talking about regression. I think my background is more emergency, and so I might not be the best person to ask. But if anybody wants to send questions my way, I can certainly try to find out things and get back to people.
Yeah. Okay. Thanks. We have another questions. It's a little bit longer. My son, he's 16 years old, has an annual blood test done, and his white cell count is sometimes very low and then goes back up to the normal. I was told by GP and read some papers which say that is not unusual in Down syndrome individuals. Would you know why this is the case?
You're completely right. We see it fairly frequently, actually, that the white cells are slightly low. Sometimes they will go up and down, sometimes they will stay low. And it's important to keep that under review to make sure that it's not getting worse, because it does put people at increased risk of infection. Again, it's linked in with that immune system problem. We don't know why this happens, and it's likely to be due to the way the cells interact with each other. But it is fairly common.
Yeah. Okay. Thanks a lot. Are children with Down syndrome under 12 without serious added health conditions or okay to remain unvaccinated for COVID? Are they at increased risks of COVID compared to the children without Down syndrome?
So the short answer is we don't know. Because of their increased risk of infection generally, it would be sensible to assume that they are at increased risk compared to their peers, to other children, but we don't know how high that risk is. There's certainly work going on to collect data around that, and there's also work going on to try to see how the vaccine works in younger children as well. And I'm sure we'll get more information. My feeling is that everything points to them being more at risk, but we don't have enough information to prove that yet.
Yeah, thanks, Liz. Another question again about vaccination. It's in Malta, Down syndrome population had the Pfizer vaccine, and now they're thinking to give them a booster. What do you know something about this? Because we know in some countries they are going with this part, but the first start with the people who has some who are older and who are sick. How is your information about our children or our population?
As far as I'm aware, after the COVID vaccine, it seems that your level of immunity gradually goes down. And the thought is that after about 6 months, that's probably the period when we need to have a booster. Obviously, there are logistical problems, and so that needs to be worked through. And as when the vaccine was introduced, it'll probably be the older population and those at increased risk who are vaccinated first. But we also need to look at that time scale as well. So it needs to be probably to be worth doing at least 6 months after their last vaccine. And Pfizer would be the right one, I think.
Yeah, thank you very much. Okay, now we have from Diana from Portugal a little bit more. She means in early ages, this statistic about cognitive degeneration. Okay. But like you said, maybe we could send you that question and then you find some more information.
Absolutely.
I hope, yes, I hope Diana from Portugal, that's okay for you, that we see how Liz could find some more information about this. We have another question from Jacqueline. It has been shown that vitamin D might help for sleep problems in the general population. Is that case also for person with Down syndrome?
I don't know, but if there's any chance that they can help Amy to sleep better, I'd be really pleased.
Yeah, maybe Jacqueline, you could also continue to search together with Liz. But really, we see, thanks a lot for this vitamin D, because I personally, I think we had a problem with our sun. Even we are living in Croatia, we have a lot of sun, but we are not going so much outside. Yeah. And our GP gave to us several years ago that we need to take vitamin D. And I say, why? What? During the winter time. But now I see when we put the results, when he saw the results, his vitamin D was very low. But very fast is going up. Just with some small oil, you could we could do that. That's good. Brilliant. Help. That's okay, nice. Jacqueline. Next, really topics for you is the vitamin D for everything, not just for the sleep. I hope and help us in this part because I was so surprised, Elizabeth, that you said vitamin D. Okay, I know for the iron, but for vitamin D, I didn't know that it's as important like Lexi. Okay, we have one long text a little bit. I don't know, Elizabeth, you could see also this all question and answer, but okay, I'll start to read and maybe just until you see that we have others as well. The availability, accessibility of health service for children and young people with a learning disability seems to be diverse and often depends on where you live. That's true, I think. We think in each country it could be different. Mm-hmm. For instance, not all acute hospitals have learning disability licensed nurses for children, and such service is sparse in the primary care. Should all health service have learners role or nurses? or what else would help individuals and their families?
So I absolutely believe that learning disabilities nurses are worth their weight in gold. They understand the problems that our children face, and they receive proper training in this area, whereas with all due respect to other doctors and nurses, we just don't get that training. We get very little training in learning disability. Yes, they're a very scarce resource, unfortunately, but I do think that every acute trust should have one or more. We have one, and I'm sure they're far too busy. Other things that can help. So in our emergency department, because we don't always have access to the learning disability nurse, we've done a lot of extra training for our staff. All of our nursing staff carry lanyards with Makaton symbols and signs on to help them to communicate. We have a box of resources, so we have a box of pictures, photos, symbols that we can use to help to communicate with children. And all of our staff have signed up to something that we call the ED Pledge. And that is a promise to our patients with learning disability or autism that we will do our best to communicate with them. We will do our best to make them feel safe. We'll do our best to try and understand what's going on. And we'll do our best to do things like finding somewhere quiet for them to wait. Because it's sometimes the really small things that can make a really big difference. It's not rocket science, it's common sense. But when we're busy and we're going through patient after patient after patient, they're the things that we forget, first of all. So I am more than happy to pass on some of the resources I have if people want to get in touch. I'm on Twitter. I'm happy to share anything that we've done locally, if that can help other places.
Yes, Liz, I think this will be very good. I could see in my country, but also in other countries, I think that will be very, very useful. Also, we have from Wales one very good information. Wales, we have a health profile for children and young people rather than a hospital passport. It's brief and well received in areas like the emergency depths. Health profile, even they put us a link about yes, and we could check and see that. Thanks a lot for this because we could share what is good in or each of our places where we are, and thanks a lot from somebody who calls us from and is with us from Wales. We have another comment. It's there is a medical control list for the people with Down syndrome published by American Academy of Pediatrics. But there is no emphasis about sepsis, etc. Are there any documents that we can use to inform families about serious illness risks like sepsis?
Yeah, so I'm more than happy to pass on links to things. The poster that we put together was aimed more at health professionals, but there is also an article that we wrote for the Down Syndrome Association Journal in the UK, which talks a bit more about the things that we've discussed today. So I'm happy to pass on links for that if people would like. Yes, please, it will be great. We have from Marion, where can I buy the stop and watch picture? So that's available online. If you I can again send the link out, but if you Google stop and watch soft signs, then that should come up. I think it was from I think it might be Bristol that have put that one together, but I can certainly share the link. Thank you very much. Yeah, Marion, another question. Can we get those rules, Marion, on which rules you are thinking? All, Elizabeth, could you think? Do you mean the red flags? I'm happy to share my slides if that's what people mean. Yeah. Yes, it will be good. These slides where you have a picture, about some warnings, about some comment. Maybe it will be good to send maybe somewhere where you have that. Maybe that we could translate, or maybe we could talk with our families about that as well a little bit more. Thanks a lot, Marion. Please write if we don't think like you think. Okay, we have one question from Bosnia and Herzegovina, from Naida.
I will ask if you have any advice for children who have an acne and don't stop scratching by infection the skin if it is the last for the long period of time.
That's a really difficult one, isn't it? And it's very difficult to treat acne, the skin infection. So firstly, trying to avoid lots of creams and things, because those can make the skin more sweaty, and that can make things worse. Trying to make sure that the child doesn't get sweaty, doesn't have tight clothing around the area, that can help. Sometimes losing weight, depending on the child, can help with acne as well. And sometimes there are antibiotics or topical agents, so creams and things that medicated creams that we'd use. As for the itching, that's a really, really difficult one. And sometimes things like antihistamines can help with an itch. Some of the medicated ointments can help to prevent the itch. And sometimes things like cutting the nails very short, so that if they do scratch, they're less likely to do any damage, can help. But really difficult to stop people scratching. I completely agree. The other thing is just lots and lots of behavioral stuff. So perhaps trying to distract when they are having a good scratch, but it can be so uncomfortable. So I can understand why they do that.
Yeah, Naida, I think I will send you what we are using for our son, what our GP gave us. I don't know, for the girls, maybe it's a difference. Maybe girls has more problems, but for the boys, for us, it was very useful what we got from our GP, and I could send that. Yeah, Marion, you said it's the hospital rules. Okay, thanks a lot. How to treat the handicapped child?
The pledge,
yeah,
something like that. Yeah, that's no problem. I can send that.
I have it. Just my husband bring for me. We are using clindamycin for the acne, for the boy. But like I said, it's a boy. It's easy, and there is going very fast because he has in the whole back even so many times acne as well. We don't have no more questions. We were very fast.
Inka, there's one more German question here.
Oh, sorry.
It says, can sepsis still happen if the person if the child is vaccinated against tetanus?
Yeah, so because sepsis is about the body attacking the infection, sepsis can happen with any type of infection. So it can happen with a viral infection, it can happen with the flu, it can happen with pneumonia, it can happen with a urine infection, it can happen with a skin infection. So any type of infection can, in the right circumstances, cause sepsis, because it's purely about how the body responds to that infection. And that makes it really difficult sometimes to diagnose. That's why it's important to look for those red flags.
Thanks a lot. Do we have some more question for Liz? No. Okay, we don't have here in the questions and answers, but yeah. If we don't have a more question, I would like to thanks to all of you who participate on our webinar today to help us to think about this specifics for our children. Most of them, maybe we know, but we see that we always learn something new, like I don't know about the sepsis, I don't know how much important is vitamin D and some other things. Even my son is 20 years old and we passed so many things, but I think we are always learning together on this all our webinars. Okay, in that case, we could close for today. And Liz, this is your first time with us webinar, but maybe we'll call you again.
Thank you very much. I've enjoyed it.
Be ready for us. Just be ready for us very soon.
Thank you for the welcome.
Yeah. Thank you very much for everything, and thank you to our Down Syndrome from Turkey group who help us to have this webinar in all organization, and also thanks to our translators and to the people who are recording in Turkish and also in German, that we have all this webinar in English, German and the Turkish. Have a nice evening and bye-bye.